Hi, everyone. Good evening.
Hi, everyone.
Hello. Do I have sharing access, Alex? You're on mute.
Thanks. I'm going to pause the recording and I'll make sure you have presenter access.
Thank you, Alex. Thank you for that introduction, and thank you everybody else for being here. My talk today is called La Gente Unida, Latinx Immigrant and Indigenous Health and Advocacy on California's Central Coast. My name is Mario Espinosa Kulik, pronouns he, él. I'm a PhD candidate at the University of California, Santa Barbara in sociology and a health policy research scholar with the Robert Wood Johnson Foundation. To start off this talk, I'd like to begin by outlining some of the motivations behind this work. As many of us have probably noticed, the previous administration had stressed a lot of attention on the anti-immigrant policies and racism in the United States. There's been a rising political xenophobic hostility against Latinx and Indigenous migrants. Stereotypes like being greedy, lazy, or invasive to US society are harmful to our community and have led to harsh policies like child detention and family separation. We've also seen how these policies impose negative health behaviors and effects. One impact is a reliance on emergency services and disenrollment from public benefit programs. We've also seen how these perpetuate inequities in health among families and communities. And of note, the public charge rule has been a main contributor for disenrollment from programs like Medi-Cal and women's and infant and children programs, as well as food stamps. Restrictive and eligibility policies to government-sponsored health programs are also a deterrent from accessing publicly funded healthcare. Unfortunately, we've seen a rise in violent enforcement like raids by Immigration Customs Enforcement and sometimes even collaborations with our local law enforcement agents. To guide this study, the indigenous social determinants of health theory was used. This theory is used to communicate that health is a holistic concept that extends beyond individual behaviors and genetics. This is something that indigenous peoples have always known when compared to Western definitions of social and structural determinants of health. Indigenous peoples have included unique structural or foundational determinants like history, political climate, economics, and social context. Things like racism and colonization, justice, self-determination, the land, environment, and control of resources are determinants that indigenous peoples have always considered in a holistic way of their own community's health. Another motivation for the study has been the rise in health disparities and COVID-19. Many studies have now shown that Latinx people are more likely to contract COVID-19, and the mortality rates of our community are nearly twice as high for our population compared to non-Hispanic whites. As well, structural racism created the most vulnerable condition for Latinx communities. When the pandemic hit, structural racism had to find who had access to care and what opportunities and resources were available to this community. Due to the high concentration of Latinx folks in essential work, there was a high risk of COVID-19 exposure. There's also been accumulated stress that increases risk for serious complications like obesity and diabetes, and barriers like language, trust, and a culture of fear have made it difficult to have a healthy life. Zooming out a little bit, this map here shows how COVID-19 has affected Latinx folks in California by county. we see that there's an overrepresentation in these areas that are deep red. In our own context, where the study was conducted, Ventura, Santa Barbara, San Luis Obispo, and Monterey counties represent some of the most affected places in California by COVID-19. Excuse me, my cat made me nervous because he meowed. Moving on, the project itself, La Gente Unida, Immigrant Health and Advocacy, is an intervention to spread awareness of these issues and also to provide recommendations as to how we can address these health disparities head on. The research was conducted through multiple methods, including a survey of health needs and assets, a content analysis of news data, including a systematic sample of newspapers from the Central Coast in the amount of 4,768 articles. Qualitative interviews were also held with community members and advocates, as well as focus groups, from the span of September 2018 to September 2020. And I also participated in the observation of in-person and virtual events throughout my time in the field. In writing the results from the study, reflexivity has been a key work ethic, always continuing to reflect on the experiences and whether or not the writing is accessible, and doing justice to the work that is being presented here today, and keeping folks in the loop. I created a public-facing website to disseminate reports to recruit folks and to be transparent about the work that we are doing as a team. The public-facing website can be found at the link here, https://lagenteunidacc.wixsite.com/recursos de salud. It's important to note that each step of the way in this project, community members were involved. Key informants helped to design the survey, as well as recruit community members to take the survey awareness of the project that was being done. I'm really grateful for the support and collaboration with our community and the local organizations that were helpful in helping this get done. The research methods that guided the study were decolonial inspired. Decolonial methods deconstruct Western research methods and privilege the voices of indigenous knowledge producers. It focuses on the margins to explore what's not being heard, what's not being spoken, and struggle. Driscoll defines decolonization as the ongoing radical resistance against colonialism that includes struggles for land redress, self-determination, healing, historical trauma, cultural continuance, and reconciliation. And Linda Chuawi Smith defines the 5 dimensions of struggle for decolonization as awakening, reimagining, intersectionality, disturbance, and structure. And through this framework, I've inspired my own research methods that focus on reflexivity to the conditions of settler colonialism, collaboration with indigenous experts, sharing knowledge in public, listening to and acting on community advice, and assessment of ongoing research norms. Awakening is the effort required to critique the status quo and identify that action is needed to make change. This is put into practice for decolonial inspired methods through reflexivity. For decolonial inspired methods, reflexivity takes on the added component to continually awaken, to see the ongoing realities of settler colonialism and erasure of indigenous peoples. Reimagining means repositioning the role of indigenous peoples in this world. Tribes, nations, and communities cultivate intellectual leadership and recognize their own experts, who may not be validated by academic institutions. To form authentic collaborative relationships, this multiple forms of expertise must be equitably valued. The strength of difference in knowledge production comes from the ability to inspire coordinated action across institutions and sectors with an intersectional perspective. To facilitate this, sharing could be open and transparent for a broad set of key stakeholders. We can also hold researchers accountable by soliciting community advice from recognized experts and directly affected individuals. For this advice to be meaningful, it must be given real weight in decision-making about research design, analysis, and dissemination. Relative to the fourth dimension of decolonial struggle, disturbance, this creates opportunities to understand how groups change and priorities shift over time. The broadest practice of decolonial inspired methods is to critically assess how Indigenous peoples and indigeneity are being neglected in research and broader society. This responds to prevailing struggle against existing structures that reproduce inequalities and marginality. Now, taken together, these practices are not sequential or hierarchical. They hold equal importance and may be repeated with varying salience throughout the practice of creating and sharing knowledge through research studies. The survey itself on health needs and assets provides information about Latinx immigrant and Indigenous communities that are not typically assessed by large-scale efforts on public health. As with the larger study, community stakeholders were actively involved in the survey process. In addition, I consulted with experts on survey design to get an effective survey of health needs and assets on the Central Coast, with a total of 177 eligible respondents completing the survey, including a majority of the respondents that identified as a hybrid of not just a community member, but advocate and community member. That was at 59%. The remaining sample had included advocates who were not part of the community at 22% and community members who did not actively advocate at 19%. This data was collected between September 2019 and September 2020, including responses that were both before and during the pandemic. In terms of the sample, it was majority women at 82%, and also included Spanish speakers at 46%, with Indigenous respondents at 17%. Some of the pressing disparities we observed in the survey data included accessing hospitals, sexual health services, and even public transportation for Indigenous communities on the Central Coast. This pattern of access disparities reflects how Indigenous peoples are continually underserved and excluded from access to health. Other barriers that were voiced by our community were language barriers. Latinx communities are an overall heterogeneous group, meaning that we're not a monolithic community. We're not all the same. We consist of a diverse group of peoples with a diverse variety of languages. Interview participants indicated that Indigenous language interpretation was a key need for meaningful health access. For example, one participant had said, even if we fight for a policy that encompasses undocumented individuals, we also have to think about the practicality of implementing these policies and how we actually reach our language minority families or our communities that don't have a written language and only an oral language. Another advocate stated, we don't really have anyone that speaks Mixteco, but we do have someone at the clinic. When we do encounter someone, we do tell them that they could call the clinic, and that usually, I believe the receptionist or the medical assistant, they speak Mixteco. So it's important to have multilingual interpreters for our community members that may not speak English or Spanish. In terms of anxiety among Latinx immigrants, predictors of those anxieties were experiencing discrimination, mental health knowledge, concern for mental health, and being insured. In terms of experiencing discrimination, this accounted for a 0.76 increase in anxiety on a 3-point scale. Being concerned for one's mental health also increased anxiety by 0.55. One of the factors that decreased anxiety was having mental health knowledge. It accounted for a decrease in 1.05 points on a 3-point scale of anxiety. And lastly, being insured accounted for a 0.47 increase anxiety on a 3-point scale. Based on these findings I just went over about drivers of anxiety scores, Recommendations that came out of the study to address mental health concerns for Latinx migrant communities are in the pyramid shown on the screen. This was inspired by the World Health Organization's optimal mix of services pyramid. It's important to have multilingual, structurally competent care in the 4 areas of the pyramid that are from the promotorexes and community health workers, primary care, mental health services, advanced health providers in general hospitals, and community mental health and specialist psychiatric services. It's also important to have trauma-informed approaches at the top of this pyramid that our specialist psychiatric services are trauma-informed, as well as our advanced health providers in general hospitals and community mental health. The bottom of this pyramid emphasizes that self-care and the expansion of public health insurance to undocumented individuals are crucial foundation that everyone needs in order to have access to mental health care. While I was on the field, I read a lot of newspapers, and from those newspapers came this analysis around the Latino threat narrative. What we did was take over 4,000 newspaper articles published on the Central Coast between 2006 and 2020. And we looked at how the topics related to one another. The topics that were most central to other topics were Latino threat narrative, politics, policy, and illegality. Latino threat narrative reproduces racist beliefs about Latinx communities with stereotypes, words such as influx, surge, alien, and invaders. And so if we think about this figure on the left as the way someone's eyes works, it shows when you look out, the information you gain from that visual data is being filtered through a lens of Latino threat narrative. Both policy and politics are communicating a message that Latinx communities are a threat. And through that, the social construction of illegality affects how news is constructed and disseminated. And that same news maintains the link between the Latino threat narrative and leads to negative health behaviors across generations. For example, Pedraza and Zhu in 2015 found that it creates a chilling effect for immigrant communities, paralyzing folks in accessing opportunities for a healthier life. Literally, people are frozen and afraid to the point that they do nothing. From the advocate's perspective related to this data, they said, what we've noticed actually is a drop in the amount of clients that come to our office when ICE is in the news. Normally, our waiting room is pretty packed and there aren't any seats available. And lately, people haven't been coming into our office. Also, like I mentioned earlier, we have those community women's classes and normally there's a high turnout, like 50 people, but now only like maybe 10 or 20 will come. That's been because of ICE and all these talks of raids, but it's also been because of the public charge discussion that's been going on. I think people are just really scared. Relatedly, an advocate interview explains, my clients see it on the news and hear it on the radio and have had experiences where people are always telling them, no, you're wrong. No, you don't know. No, you don't speak the language. It's like, I've been told this a million different ways in a million different spaces, so it must be true. They don't fight back and they don't utilize the rights that they have. To combat these negative effects from the news discourse that communicates Latinx folks as a threat and the anti-immigrant policies and racism that these communities face, social movements, especially immigrant rights movements and immigrant health movements, have mobilized essential worker framing. Essential worker framing has been used to advance health policy and gain resources and publicity. For example, raises for the strawberry season, as well as mutual aid funds, movements have also responded to this exclusion from CARES Act spending, like the 805 Undocu Fund, which recently announced $5 million distributed to undocumented communities on the Central Coast. Immigrants were systematically excluded from receiving pandemic aid during the Trump administration. Advocacy groups draw on the pre-existing resources for mobilizing under these hostile conditions with limited resources even. They relied on their own people to make masks for their community and to communicate about vaccines, to communicate about personal protective equipment, and how to mobilize as a community as we face this pandemic. One organizer shared, nuestra estrategia es más que nada seguir insistiendo, seguir tocando puertas por puertas, seguir insistiendo, dándoles la información correcta. Hay muchos recursos de los que ellos se puedan beneficiar. No importan las opiniones políticas. Hay mucha información, muchos beneficios. Eso nos hace más fuertes. When translated in English, this means our strategy is more than anything to keep assisting, keep knocking door by door, keep insisting by giving them the correct information. There are many resources for their benefit. Political opinions don't matter. There's plenty of information and many benefits that makes us all stronger. We see this strategy through community education. Advocacy groups have shared this information about pressing health inequities and policies, breaking down language barriers in the process. For example, translating from Spanish to Mixteco and making materials accessible, not only in English, but also in Spanish and indigenous languages. We've also seen artistic expressions by our young people communicating the importance of social distancing to protect each other and maintaining our community health. These community-led materials are culturally responsive and center youth voices. One advocate shared, language is a huge barrier. Mixteco, there's not only one variant. There's, I believe, 23, if not more. Yes, big barrier, but that's why there's organizations like 805 and DocuFund or MICOP, Mixteco Indígena Community Organizing Project, and Importa. We explain things about immigration at least and other things. Yes, that is a huge barrier, but hopefully with this whole situation that we can all collaborate, or more young people that speak Mixteco can work in these spaces. That's my hope for the future, and I think that'd be very awesome. Solidarity and health policy were very important to immigrant health movements. In the summer of 2020, we saw a rise, and even currently, a rise in anti-Black racism. In response, immigrant and Latinx organizations, especially Mixteco Indígena Community Organizing Project, expressed their solidarity with the Black Lives Matter movement by not only sharing their materials, but also translating them to communicate the importance of appreciating Black lives and showing up in solidarity with our communities of color and advocating for their policies. Policy victories like better pay, working conditions, and access to personal protective equipment have been gained, as well as increased housing and health protections to combat COVID-19. At the beginning of 2020, there was also the expansion of Medi-Cal to undocumented young adults up to age 26. For example, in Santa Maria, farm workers had received a raise after over a month of organizing. These organizing efforts included the workers launching an online petition, which garnered attention across the country and resulted in over 61,000 signatures. It's important to note that even though they've gained a raise of $2.10 per box of strawberries at the time, there's still a lot of produce that has not been given an overdue raise for our farm working communities to thrive. During the time of organizing, farm workers were targeted for retaliation by their employers. In collaboration with Cause, these farm workers actually received settlement checks after facing that retaliation. Over 212 checks were given out to the community, and farm employees were educated on labor rights. With all of this work taken together, the stories from the advocates, the advocate community members, and community members themselves, we've seen the story of resilience and advocacy. We've seen how movements have translated their materials and interpreted key information for their constituents, provided direct support funding and services, and have been advocated policy for systemic change. In the face of vulnerabilities and disproportionate negative impacts of the COVID-19 pandemic, advocates have demonstrated high levels of resiliency in serving communities and fighting for change. In conclusion, decolonial-inspired methods are useful for engaging with community collaborations and producing tangible outcomes methods like op-eds, community reports, presentations, and a public website. Collaborations with community members, nonprofits, and partners, and direct service to communities and Indigenous peoples were used to engage with the community and make this an effort that truly resembled the name of the study, Gente, Unida. Structural racism intersects with xenophobia and settler colonialism and produced a unique vulnerability for Latinx immigrant communities. These barriers included not having access to insurance, language barriers, and mental health. Latinx immigrant health movements have also responded to the pandemic by mobilizing for systems change at every level. And those levels could be access to health resources, adapting the pandemic conditions, and advocating anti-racist change systematically. Some recommendations that come out of this study are to expand public health insurance and to include all ages of folks, regardless of documentation status. Also, to support language access translation and interpretation. To affirm that racism is a public health crisis. Recommended interventions include to build our healthcare capacity on the Central Coast with a lens of equity and to promote implicit bias and anti-discrimination trainings throughout our community. Well, what can we do as community members and policymakers? We can lend our support to California legislation, combating the structural racism that exists in our health system. For example, bills like SB 56 would expand Medi-Cal to include all eligible undocumented adults, 65 and older. SB 40 by Senator Hurtado would expand our workforce in the medical field through the California Medicine Scholars Program. Other bills like SB 682, sponsored by Senator Rubio, would close racial gaps in childhood chronic disease. And finally, Assemblymember Bennett's bill AB 941 would create farm worker resource centers that would be a multilingual community partnership to increase access to services related to education, housing, payroll, wage rights, and health and human services. At the local level, we need to raise awareness about health inequities in our communities and disallow coordination between county sheriffs and city police with immigration and customs enforcement. We also need to create supportive pathways for underrepresented young people to pursue careers in healthcare and policy. Finally, institutionalized funding for multilingual interpretation services is crucial. But I believe that together, we can do it. We can achieve health equity for our communities on the Central Coast. I'd like to acknowledge Corazón del Pueblo, the Cultural and Creative Arts Center of the Santa Maria Valley, for hosting this community talk this evening. My dissertation committee, including my chair, Dr. Victor Rios, and members, Drs. Verda Taylor and Edward Theas, all of my community partners and leaders for lending their support and guidance throughout this entire study, my research assistants, Elisa Gonzalez and Joreen Takahashi, and my partner and husband, Dr. Alex Espinoza-Kulik. Funding for this project was provided by the Robert Wood Johnson Foundation and the Health Policy Research Scholars Program Dissertation Award and Dissemination Award. Additional funding for this project was also received by the Community Change Leadership Network, the Scholar Strategy Network, University of California Santa Barbara Migration Initiative, and Cal Poly's Believe, Educate, and Empower, Advocate, Collaborate, and Nurture grant. Here are the references for further reading and information on these topics, and we'll be sharing the slides and the recording of tonight's talk on the Corazón del Pueblo website and social media. Thank you all once again for being here. I'm happy to answer any questions.
Thank you so much. That was incredible. Thank you for sharing such important information and so grounded in our local community.
Thank you.
Who has a question for Mario? You can also drop it in the chat if you'd prefer.
I have a question.
Yes, Suzanne.
Hi, and
Hi.
that was amazing, Mario, and thank you so much for your work. I'm just so impressed and so grateful, and thank you for having a mixed tech interpreter and for all your contributions. My question is, I was amazed to see and happy to see that the mental health knowledge decreased anxiety. And you said, I think it was like over 1 point on a 3-point scale. And that was I was very happy to see that. And I'm wondering if you know more about what that knowledge was. Was it kind of knowledge of where to go, or what was that exactly?
Right. So I'm not sure that we defined mental health knowledge on the survey itself, other than like broadly having mental health knowledge. So I think that's the answer there, is just having any mental health knowledge accounts for a negative 1.05 decrease in mental health anxiety.
That's great.
Thank you. Antonio? Hi.
Hello. Well, I just want to say, first of all, thank you for, you met with us individually with the City of Guadalupe to include us in the survey. And I think that was a really awesome thing. I was been on a soapbox lately about the inclusiveness of North County and even South County, San Luis Obispo, to make sure that voices are heard. But, and I know the mayor's here, and I may overstep a little bit, but we definitely would love to have you at some point to be able to give a presentation like this to the city council, so the rest of the members, because I think part of it is a lot of times people feel like I just have to deal with local issues, and we have to realize that this is a local issue, and that this our impact and our voice needs to be heard state level and national level. So I think as long as we start creating those ripples and supporting legislation, like you said, that are at the state and national level, then we need to hear more from researchers like you.
Thank you. I appreciate
So not
that.
really a question. So the only question is, will you come?
Yes, I'd love to go present in Guadalupe for the city, and any community members that would like to participate.
Awesome, thank you. We'll link up.
Sounds good. Sarah. Hi.
Hi, how are you, Mario? That was fabulous. I forgot completely about that. I looked at my clock and it says, oh, but I'll get something and I'll look at the stuff earlier. But I do have a question. Would you like to come talk to the Democratic Club in June?
Totally. Yeah, I'd love to talk at the Democratic Club in June.
Yeah, because I think this is such an important topic, and other organizations that might be interested. I mean, we've got to get the information out, and you have everything. I love the way you did your presentation.
Thank you. I appreciate that. I'll connect with you about when to do that.
Okay.
David. Hi, thanks for coming.
Hi, Mario. Really awesome presentation, hermano. Just, it just brings a lot of, I want to say, encouragement in terms of, we've been advocating for so many of these things with local policymakers, etc. And I think, having the numbers and having the research just helps us, further cement why the work that our community members is so important. And I think it would just help us so much in terms of advocating for more of those systems change policies and stuff like that in our city councils, especially, if we can bring these types of things up for discussion, for public comment, I think it would just really help, not just help us advocate, but also support the advocacy. But thank you so much, Mario. Really great.
Thank you. I appreciate that. And I'll be making more of an effort to submit public comments from the data to our local city council meetings. Olivia, thanks for coming.
Hi, thank you, Mario. That was so enlightening, and it was just absolutely wonderful to see all of that data in one place. It's so important. Thank you for doing that. And I had a question regarding, I'm from the Tobacco Control Program, as you know, in SLO County, and we want to make our program more equitable for our Latinx community. And we are struggling because none of us are very fluently bilingual. I think we just don't really have the toolbox that we need to make it more equitable. And so we've kind of thrown around the idea of having someone come in and sort of train our staff on how to better reach that community. Because in our county, the north part of the county is, there's a large Latino population in that part of the county, and we'd love to conduct more outreach and be more versed in that, in order to provide quitting services for, vaping, cigarettes, that kind of thing. So I don't know if you had any organizations in the Central Coast area in mind that might be good to, hire to help provide us with some training in terms of getting better at outreach with that community.
Totally, yeah. So actually in the summer, because of the nature of this data, we had launched our own business called Queer Profs, and we would be happy to talk to you more about doing trainings on this matter of equity. We're right now talking to Gala about a similar, Gala Pride and Diversity Center about a similar request. But that's one that I know, and other folks that are able to help with this effort would also be Herencia Indígena. Herencia Indígena is actually the folks who are providing the interpretation right now. And they're a really great group to work with in terms of reaching and translating materials in Indigenous languages.
Thank you so much.
There's a question in the chat, Mario, from Lata Murti. She said, phenomenal research and public intellectualism, Mario. I'm wondering, how much do the characteristics of the health professionals themselves matter? Not just language, but specialty, job title, physician assistant, nurse practitioner, or doctor, age, and race. Especially specialty, given that locally we seem to have a health professional shortage area in certain fields, like OBGYN, I believe. Thank you, and apologize if you addressed it earlier. Also, immigration status of doctors.
Gotcha. Thank you, Lata, for the question. I think that the characteristics of the health professionals mattered in terms of cultural humility and also language accessibility. But like also there was a lack of specialty providers in this area. So folks have to like drive to Los Angeles, drive to Stanford, drive to the Bay Area to actually get those services. So I think one of the answers to this question might be we need more doctors of different races, different ages, different languages in the Santa Maria Valley, but also in the Central Coast in general. We need to be paying attention to who we're hiring in the medical capacity. Right? To your point about specialties in the health shortage here, that is a very lived and felt reality for our community members, especially Indigenous peoples. Like I had mentioned, there wasn't a lot of access to sexual health services, hospitals even, and even a way to get to the hospital or to sexual health services. So certainly I feel that our medical workforce in the Santa Maria Valley and in the Central Coast in general could be more robust in terms of the offerings of specialties. I mean, even for myself as someone who's immunocompromised, has to go all the way to San Luis Obispo from Santa Maria to see a specialist in infectious diseases, right? There's nobody here who specializes in what I need. And I think as well, the immigration status of doctors, cultural relevancy is important, right? If we have doctors who are also of a migrant family, a mixed status family, undocumented, would be helpful in reaching hard to reach patients. Alex, can you help me who had their hand up first?
I believe Joan had her hand up first.
Joan, thanks for being here.
Hi, thank you so much. I'm sort of thinking about a number of different things at once. I really appreciated the discussion about indigenous cultures having a broader, more holistic definition of what health is. It's not just, you know, when things go wrong, it's really how you have, I hope you can hear me okay, broader understanding of what, and I thought that was really important. I have the same issue as Olivia, that is, I work for county government, and how do we reach into marginalized communities better? We've certainly done it through COVID much more effectively, especially with the help of UCSB's Center for Publicly Engaged Research. But it raises the question that we're struggling with in our county. How do we reach out better in terms of transportation policy, in terms of sustainability issues, pesticides, and I'm very much interested in recreation and trails and outreach. We're experimenting with actually paying people or organizations to participate. But I noticed even in your survey, you had more advocates than actual, if you could go back to that chart. Yeah. So you had, I mean, you had a representative group, but it's, you know, when people are working 2 jobs, they have families, or I mean, it's just really hard to get them engaged. And so any enlightenment, any direction, I think we share this across government agencies. We know we need to do better, but we're struggling for new methods, new ways of doing it.
Totally, thanks for bringing that up. I mean, from this slide, we can see that advocate community members were the majority. So we can infer from that they're not just living their lives as a community member, you know, being in kinship and stuff, but also having to work double duty, having to live, but also advocate to live for their communities and their families. So I think we can look to the work that's been done by CAUSE, by Future Leaders of America, by MyCop, right, that they've been able to reach their own communities in a way that government and other private organizations couldn't have ever imagined in the wake of a pandemic. So I think that the answer here is, in order to reach the community, we need to be with the community and do it in a way that resembles equal partnership, right? That the stakeholders are involved in the design of recruiting participants for a survey, that they're involved in strategizing outreach efforts for their communities. I think that's where we've seen a lot of success even now with the vaccine clinics that CAUSE and Herencia Indígena and MICO have been working to gain accessibility for our families and community members, because they're at the front line with folks that like government, but they're also there side by side with their community.
And if I might just follow up, you know, I'm a big supporter of CAUSE for one, but it puts a lot of burden on them to have to, you know, do this across the board. But maybe we just need to build even more capacity. And I was shocked to find out how under-financed organizations are that represent marginalized people. And we just need to make that a much bigger priority.
Totally. Yes, definitely building capacity for our local organizations to actually serve our communities is a priority. And I feel we would have more organizers and more success with our organizing if we had more capacity. Oftentimes, local organizations are funded by grassroots campaigns, private donations, and other foundations. But there's not like enough money to go around for all of the community organizations that are doing that work. So I think we can look at reallocating our funding structures to prioritize community organizations that are hurting right now, especially the folks that have been doing what they can on their own. Like, I was really impressed along the way when I was doing this research that the 805 and DocuFund had managed to raise so much money to give directly to our communities. And I think that was done through collaboration, not just with 805 and DocuFund, but leaning on other partner organizations in the area. So even in our own work as community-led organizations, we are leaning within each other to get this important work done.
So I'm jumping in one more time. Yes, and I think the reframing, as you said, to essential workers, that really helped, I think, raise money. And as far as the, organizations like Cause, I believe a funding source is for government to pay them as contractors to do some of this outreach. And that's the direction that I.
Thank you. Abby? I don't think I can hear you. I'm sorry.
This time, did it work to unmute? Yes, I'd like to introduce myself. I started 2 months ago in the position of Health Equity Coordinator for the Public Health Department in San Luis Obispo County. And I know that your survey was completed in September before vaccines were available, but I'm curious whether you have any thoughts on messaging or special barriers to keep in mind with the vaccines, that we want to make sure we make it as easy as possible for everyone.
Definitely. That makes me think about the community education that I saw and learned about in the field. You can see here that although there are various ways of communicating information, artistic expression was one of them. And then also indigenous language. But I even feel like that might not be enough, right, for vaccine outreach because of this digital divide that's very real in our counties, where families of color, particularly migrant and Latinx families, don't have equitable access to the internet and don't have equitable access to California myturn.ca.gov, right, to make that appointment. So I would definitely suggest that community education be strategized at a grassroots level, that folks are able to actually access these services without having to jump through all these different hoops to get a vaccine. One thing that I just saw from Cause, right, is announcing when there are walk-in vaccine clinics, right, that folks can just walk up and get a vaccine rather than having to make that appointment and wait for a system to tell them when their actual appointment is. So I think being more forthcoming and more direct with the vaccine operations and scheduling is actually more effective than a statewide system for appointments.
And San Luis Obispo County will in a few weeks be on my turn, but for now, we have not been, and we have an alternative that people can call both through our Promotoris group and schedule appointments, or through a general phone assistance center that does have Spanish speaking, but not Mestico persons hired. But you'll know from Iribid that we've also used the assistance of her organization at our events where we've been reaching out to Latino community.
Thank you, Abby. Nice to meet you.
Yes, and I look forward to talking to you in the future.
Are there any and are there any more questions for Mario? Well, thank you so much for your talk, and thank you everyone for being here again, especially our representatives from the City of Guadalupe and the County of Santa Barbara. I will share just one more time some information in the chat about Corazón del Pueblo and the project. So we have the website where you can learn more about Mario's findings, and the website Ferencia Indígena, who did our interpretation tonight, and is also a great partner for language accessibility in the community. And then for more events like this and other cultural and arts programs, definitely follow along with Corazón del Pueblo. And if you're able, please make a donation tonight to support our local culture and arts programming. Thank you again so much, everyone, for being here, and we'll definitely be in touch.
Thank you. Have a good night, everyone. All right. Cool. Is the recording?